Hello everyone, I am Dr. Sandeep Harkar. I am a senior consultant in the Department of Urology and Renal Transplant at Artemis Hospital, Gurgaon. I shall be discussing the management of prostate cancer with you today. You will be surprised to know that prostate cancer is the second most common type of cancer and sixth leading cause of cancer-related death in men worldwide. And the incidence of this tumor is increasing in India also. Early detection of prostate cancer is a problem because it does not produce any symptoms. It may be growing inside the body, but we may not be aware of it. So how to diagnose this problem? It can be diagnosed by a physical examination and a simple blood test, prostate specific antigen, PSA. So PSA, if abnormal or there is problem with the physical examination, that leads to suspicion of a tumor, which needs to be confirmed by a prostate biopsy, in which we place a needle inside the prostate gland and take a little bit of tissue for laboratory testing. Now here I want to clarify 2 points. PSA test is being frequently done by people themselves also nowadays, and if it comes abnormal, patient gets depressed thinking that he has got a cancer, but it may not be always true, because PSA is raised in infections also and other conditions also. So we need to do these tests under supervision of a doctor who decides what is the relevance. And second thing is the biopsy. People have an apprehension that biopsy, putting a needle into the prostate gland, may lead to aggravation of the problem. It may lead to spread of the disease, but it's also not true, because research all over the world has shown that prostate biopsy is safe and does not lead to any dissemination of the disease. Now prostate biopsy also tells us what is the severity of the disease, what is the aggressiveness of the disease, and if it's abnormal, then we have to do certain scans like bone scan or a PET scan to stage the disease. Once the staging is done, then we can discuss the options with the patient. The options include active surveillance. That means the patient is put on a regular follow-up, and to see if the disease progresses, then we intervene, otherwise nothing to do. But in some patients it might be a higher stage with more risk. In those cases, if the disease is localized to the prostate, then the option of surgery is there. Surgery means removal of the prostate gland in total, which can be done by open technique, laparoscopically, or by robotic. Now other option is radiation therapy, which also has very good results. If the disease is advanced, it goes to other parts of the body, then the option of hormonal therapy and chemotherapy remains for control of the disease. So in a nutshell, the good thing is that prostate cancer is a slowly growing tumor most of the times, and it gives us enough time to intervene. But we need to be aware of the problem, we need to be actively monitoring so that we can detect the disease early and intervene at the right time. Thank you.